Does anyone find it odd that we have so many more children and teens on psychiatric drugs today than we did 20 years ago? And that most of these drugs fit into the same category as cocaine? How do we account for this increase? What are the risks? Are there side effects? You need to be informed. You need to find out what kids have to say about their mental health experience, and to hear from parents who have dared to question the indiscriminate use of psychiatric drugs on their kids in the captive school environment. Here is one such story.
I just remember telling him, I will never agree at this meeting. I'm telling you, I will never agree with you that the best thing to do for my child is to give him 4 or 5 different medications at the same time, not to mention even just one by itself, because I had started to read. I'd started to educate myself. And I was aghast that we were prescribing a 8 or 9-year-old boy medications that in every free world, every other country, in the free world, where certainly intelligent people and intelligent doctors live and reside and practice, that it's illegal and unthinkable to even do this. So, I was just aghast and horrified that hey, you don't love your child because you're not doing what we tell you to do. I was basically forced to, do their will, at the risk of losing my parental rights even, And certainly the first thing I had said, without getting into too much of other stuff, is, I said, well, let's try other things. I'm not going to sit here and tell you that medication is not the answer. I'm not going to sit here and argue with you. You've got alphabet soup after your last name, You've got every degree in the world. I'm just a guy from North Carolina, that loves his son. But I said, maybe we could try some other things first, before we go that route. And, of course, I was immediately corralled and whipped into shape by the court system where, give your son these drugs or you'll never see your son again.
Mostly they make you feel sick and they make you feel worn out, and like everything is just so monotonous. Just everything is so boring and just makes you feel gross.
At one point, diagnosed him with a plethora of different illnesses, Tourette syndrome, clinical depression, ADHD. There was another one there, I can't recall what it was, and I just remember looking at the doctor in the room in this meeting and just telling him that I thought he was out of his mind. And certainly he had to be, because I had been certainly with Nicholas quite a bit. We were really pretty close, even though I was kind of an every other weekend guy. He was just so different than what they were telling me that he was. And it became almost surreal, because I would say, that's not him. Where's all this behavior being exhibited that it's to the point where you've got to have him on every drug that is available?
I think it's like the reason they prescribed me the Prozac was because the ADHD medication was making me feel, look, and act like I was depressed. Like it would help me concentrate, but I couldn't have a conversation with somebody. I couldn't eat. It just made me feel the daily life was sleeping and eating. I could hardly sleep. It seemed especially on Adderall. I couldn't sleep at all or eat. And I think it was because it was a higher dosage than the other stuff. But I would lay there and try to fall asleep and just be wide awake and couldn't go to sleep. And couldn't eat. I always felt sick at lunchtime. I'd just sit there and just not be able to eat. And I lost a lot of weight when I was on all the different kind of medications.
What I noticed about my son when he was on these psychiatric drugs, in particular, was the very essence of who my son was and who my son was going to be. The chalkboard of who he was going to be as a man was being changed and written on by people that I didn't even know, that I have never even spoke to in my entire life. I felt like he was going to be another victim.
Felt like, I guess the only way to explain it is I felt more like an animal, like I was being tested on, and let's try this, and let's try this, and let's try this, and I just always felt like some kind of test thing. I met a lot of different age groups and a lot of different reactions to certain different medications. I had one friend in particular that was on medications for like depression and anxiety, and whenever she took them, she didn't act like herself. She was even seemed more antsy, like more nervous about stuff. And that was just one person in particular that I worried about a lot. When I first came home and I learned that I would no longer be on those medications, I felt like I had developed some kind of dependency to them. Like, not necessarily I needed them, but like I was worried that I couldn't do it without them, definitely. Because that's what I had been told, that I needed these to operate, so that's just always what I thought. What actually happened was I started feeling almost cleaner. I felt much cleaner, brighter feeling, and it was, yeah, I can be a little hyperactive sometimes maybe, but I just call that energetic. I don't think that I need any kind of medication for that. I would tell kids that they don't need the drugs, and that doctors go to school for a long time, but they don't always know what they're doing. And it may not necessarily be the doctor's fault, because maybe they were told the same things by someone else, that this is just the right thing, people need these medications, but I don't think anybody needs them.
For more information on psychiatric drugs and the alternatives, visit our website